You're watching CBS Local 2, where local comes first.
Well, May is Skin Cancer Prevention Month, certainly an issue for those of us living out here in the desert. And of course, there are some things you can do to protect yourself in the sun.
In the studio this morning with us is Dr. Timothy Joshin from Contour Dermatology in Rancho Mirage. Dr. Joshin, welcome, and I guess you're here to get us in the know this morning.
Let's talk about it a little bit, Doc. Obviously, skin cancer, a big concern out here in the desert. Let's talk about the prevalence of skin cancer out here. How many cases do you typically see in a given year?
We see hundreds of cases every year, probably thousands of cases. We have a population that loves to be in the sun, and skin cancer is highly associated with sun exposure and sunburn. So we see a lot of people out here in the desert.
Now, are there different types of skin cancer that you treat, different variations of this?
Yes, the three most common, well, there are three forms of skin cancer, and they are, the most common form is a basal cell carcinoma, the second most common form is a squamous cell carcinoma, and the most deadly form of skin cancer is the melanoma.
And doctor, can you tell us how we would recognize this if we had these skin cancers on our body?
Sure, of course. Well, the most common form of skin cancer, the basal cell carcinoma, most commonly looks like a shiny flesh-colored bump, sometimes with dilated blood vessels in it. We're now looking at a melanoma, and a melanoma can be distinguished from a normal mole by the ABCDs. And first is asymmetry. You can see here it's not round, it's asymmetrical. B is border irregularity, there's not a smooth border, and C is color variability or darker spots. Now here we're looking at a squamous cell carcinoma, and squamous cell carcinomas most often will look like a red scaly spot on your skin. Sometimes they'll look like a dome-shaped insect bite. And then the third type of skin cancer is the basal cell carcinoma, and again here we see a shiny flesh-colored bump, sometimes with a central ulceration and sometimes with dilated blood vessels in it. So if you see unusual marks on your body, you want to get to a dermatologist. Again, here we have a melanoma, and you can see that this is a very dark spot, and it's got bleeding pigment into the surrounding tissue.
Doctor, would you agree that it's safe to say a lot of people kind of underestimate the threat or the potential damage, the potential harm from the sun, especially amongst younger kids today, teenagers? They go out there, they think they're bulletproof, and we often really don't think critically enough about this issue.
Exactly. Well, as I mentioned earlier, skin cancer is highly associated with sun exposure and sunburn. So you want to be very careful with your sun exposure. So we're always recommending that people use sunscreens when they go out in the sun. So we recommend an SPF of 15 for daily use. And if you're going to be out for extended periods of time, I like to see people use an SPF of 30. It's critical that you reapply your sunscreen, though, because sunscreen does come off as easily as it goes on. So that's key. And you want to try to avoid the peak hours of sunshine. For people like me, though, that's a little bit unrealistic, so I tell people to wear sun protective clothing and hats. And they actually have some really stylish sun protective clothing now, and when I wear it, I find it more comfortable than even wearing cotton.
Doctor, I have a couple questions for you. One on preventative and one also on just the sun. And that is, we're hearing so much research that vitamin D is so necessary in our diets, and we're not getting enough of it, but we can get it from the sun, just spending some time out in the sun. So first of all, I'd like to know about the vitamin D factor and spending time in the sun. And also, what do you think about faux tanners?
Well, first of all, the vitamin D issue, that's a big variable for people. Now, we do know it's important to have appropriate vitamin D levels, but dermatologists really recommend that you get your vitamin D supplementation through oral ingestion as opposed to being in the sun, because those factors are very unpredictable, or they're variable depending on what time of year it is, what time of day it is, and how far you are from the equator. So we really recommend getting oral supplementation, which is more predictable. Now, I'm sorry, what was the second question?
The other one was the faux tanners.
Oh, the faux tan, yes. Now we're starting to get restrictions on sun tanning, especially for youth. People under the age of 18, you can't tan now unless you have an adult's permission.
Talking about tanning beds.
Yes, exactly, right. Exactly. So I'm a real big fan. If you really feel like you want to have that glow, some people think tan is healthy. Dermatologists see it as a sign that you've actually damaged your skin. But if you really are you really have to have that tan. I really highly suggest that you get the faux tan because they are safe and it gives you that look without actually damaging your skin.
Okay, so if you want to glow, go faux. Is that what you're saying, Doc?
That's it.